So now you've been a pioneer in robotic assisted surgery and then even other kinds of surgery. So generally just speaking about robotic surgery, tell our viewers, if you can, what's the benefit of that? Why do we want a robot involved in the surgery, and what kind of added benefit do we get from that?
Sure. Classically, prostate surgery has involved a larger open incision below the belly button down to about the waistline. And depending on the surgeon's experience, this was a very effective way to perform surgery. But over the last 10 to 15 years, with the development of robotics, and right now it's the Da Vinci surgical system from Intuitive, the majority of these procedures have become and now are done robotically. And what that means is that there are robotic arms and instruments that are placed within the patient, and then the surgeon controls these robotic instruments. So he sits in a console and performs all of the movements with his hands. You know, if I'm doing it with my hands and feet, and the robotic instruments that are placed within the body undergo the same movements. What this has led to is much greater surgeon comfort. We have a very a 3D image, which is very magnified, and we have very precise instruments.
I see.
And this leads to good outcomes and results at maybe a younger stage, at an earlier stage for surgeons. So we overcome the learning curve.
Interesting.
And also there is a suggestion that results may be a little bit better with robotic surgery versus open surgery in terms of getting the important functions back, like erections, like being able to hold the urine, which is called continence.
Sure.
Furthermore, there's less blood loss and seemingly less complications with robotic surgery.
Very interesting. Okay, so we covered a few different things there, Dr. Stein. We talked about the fact that you spoke that the robotic surgery enables a more precise surgery, so that even a less experienced surgeon can do a more precise job and get a better outcome for the robotic surgery. And you also talked about the less likelihood of having complications of the surgery. So we should speak more about that in a minute, because I'm sure our viewers want to know about, well, what are the potential complications of surgery. If you could also, while we're still talking about surgery, touch on the notion of the less invasive robotic surgery, because my understanding is you've also developed techniques for single port surgery, I think you called it.
Right.
So if you could tell our viewers, what's the single port surgery?
Okay, so single port surgery is a way that we've decreased the number of incisions that we need for robotic, or what we call also laparoscopic surgery. Typically, standardly, I make 5 incisions across the belly in order to perform the robotic surgeries, but now we're bringing it to the point where we only need 1 small incision in the belly button, and through that we can do the entire surgery and also bring the prostate out. We don't crush or chop the prostate into pieces. We take the whole thing out, but we can get that out through a very small, almost imperceptible incision in the belly button.
Amazing, because the belly button's already got sort of a shape to it where you can hide your incision in there, and that way the person looks like they never had surgery.
Correct. Yes. And this concept is popular enough that companies, including Intuitive, are developing specific technology where we can improve the robotic platform so that we can do these single port surgeries quite easily.